Hi, good afternoon, everyone. Am I audible?
Yes, you're audible, Navila. You might have to close your screen sharing though.
Yeah, okay. I just wanted to test mic of all the panelists quickly. So, Arvind, can you just unmute yourself and speak once? Am I audible? Arvind, are you there? Avinash?
Yeah, Navila, you're audible.
Kyra, can you unmute yourself and speak?
Yes. Hi, I can hear you well.
Great. Lisa, can you do that same?
Can you hear me?
Yeah, great. Roshni?
Yeah, hi Navila, I can hear everybody.
Great, okay. Singh ma'am, can you hear me?
Absolutely, yes.
Okay. Vikrant?
Yes, Navila, absolutely. Everybody is clear.
Great, okay. Good afternoon, everyone. So we welcome you all to another session of Spear India COVID-19 Academy. And this session, today's session is about working in the urban slums during COVID-19. It's a panel discussion wherein we are talking about how pandemics, which are known to facilitate large-scale social change processes. So during this COVID-19 pandemic, it has revealed that there are deep fault lines in our society and cities. Slums, migrants, informal sector workers, and numerous tolling bodies that keep our cities running all are at receiving end, but of the many policy position and also negatively portrayed in public imagination. So it is in this context that this entire discussion is designed, that we'll be sharing the learning from the various organizations working in slums and the people who inhabit them. We'll also be talking about the part of solution on how in a post-COVID scenario, we can and we should work with communities and make cities inclusive for all. So our session will be revolving around this. To deliver this session, we have a very eminent panelist with us. So I would like to introduce our first panelist, which is Mr. Avinash Singh. He's Head Program Management, Urban and Resilience, Save the Children. He provides techno-managerial leadership for overall management and implementation of a robust, comprehensive urban and resilience program in the organization. He also technically inputs for design and development of urban and resilience portfolio. Welcome, Avinash sir, to the session. We have our next panelist, Arvind Uni, who is Manager, Urban Poverty, IGSSS. Arvind is working as an urban poverty thematic lead with Indo-Global Social Service Society, handling development intervention with the most marginalized section of the urban poor in more than 30 cities spread across 15 states. Welcome, Arvind, to the session. Looking forward to hear from you. Our next panelist is Kyra. She's country representative TDH, and she's currently based out of Kolkata. And currently, the foundation is involved in implementing COVID response activities in Orissa, West Bengal, and Jharkhand. So she'll be providing us guidance and support resources and tools and government structures in order to defend the children rights in all the sectors. We have another panelist, that is Roshni. She is Executive Director at Youth for Unity and Voluntary Action. Roshni works on issues of youth and child rights, migration, informal economy, gender justice, and governance. She also facilitated children's research and advocacy and published on themes of urbanization, children's participation, and governance. Our another panelist is Ms. Sigda Sehel. She is also Executive Director for Action Against Hunger India. She has created value in the areas of women and children health and nutrition, women empowerment, education, and clean drinking water. Most of her work is also targeted at behavioral change amongst the community, partners, and donors. Welcome, ma'am, to the session. We have another panelist, Ms. Lisa from Caritas India. She is Thematic Manager, Anti-Human Trafficking and Migration. And currently, the organization, along with the organization, she is working in coordinating Indo-Nepal cross-border for anti-human trafficking. Welcome, Lisa, to the session. And we have our moderator for the session, Mr. Vikrant Mahajan, CEO, Sphere India. Vikrant has 24 years of professional experience working at interagency policy level and frontline humanitarian action with government, UN, corporation, and armed forces in diverse contexts. He also has led interagency coordination for more than 100 disasters and represents governance and policy level committees for several international organizations. So with this, I welcome you all to today's session, and over to you, Vikrant, to take forward the session.
Thank you so much, Navila. And I think you have already set the context, the post-COVID. We see the disparity in our society, and we've seen one of the worst effect has been the reverse migration of the migrants and the migrant workers across our cities. But I think there's another component in our cities is most of the urban concentration is the slums, and that's where we see very high density of population, and it's difficult to imagine in this kind of high density of population, especially the way they live, the facilities over there for water, sanitation, I think hand washing. I think the concept of social distancing is very, very challenging to think of, and when more than 8 to 10 people are sharing a 10 by 10 room. So that's the challenge of being there in the slums in this time of the COVID is more challenging. And today we have a eminent panel of the organizations who are on the front end of working with the communities in the urban slums. Some of them very, very technically specializing on working with the slums population. And I think we will build on to hear from their experiences. And I will first like to go with my colleague, Mr. Avinash Singh from Save the Children. We know about Save the Children's work. They're working with children across the country. I think I've been one of the close partners in most of the disasters, setting up child-friendly spaces. But to you, Avinash, so please share with us, a bit more about the work which is happening in slums now. Which are slums you're working in the COVID context? Or what have been your experience with what kind of interventions you are doing, and what are the challenges and issues over there? Over to you, Avinash. Look forward to hearing from you.
Yeah, thanks, Vikrant. So as you are aware that Save the Children works for children, and we have the vision that we need to build a world in which every child attains the right to survival, protection, development, and participation. So our programmatic footprints are in 16 states, and we have been working on education, protection, health for the last child in the communities. And in the pre-COVID-19 situation, Vikrant, we have been working on all these issues in the number of urban communities. If we broadly speak about, so our 47% of the programs across India are being implemented in the urban context. So I would not go in much details at what COVID changed, because I know that the people who are working with the children are aware that how these services for children got badly impacted once the COVID-19 struck and the lockdown started. Even now, we are in the unlock 1 stage, but these facilities are not fully restored for the children, even if you talk about the school or ICDS center and the health facilities. So during the lockdown 1, and even the lockdown, say unlock 1, which started, so we primarily focused on, the first thing we focused on touching base with the children and with the communities and their families actually through using the telecalling method. So the basic idea was that they should know that we have been interacting with them on a regular basis before the COVID-19. So we have not gone away from far from them. So we are there. So the idea of these telecalling, that how we can provide them such needed comfort and psychological support to them, and also at the same time do a reality check that what is the need on the ground and how the services are functioning. And we also, with this medium, we took the messages of the prevention, that how they can prevent the situation of getting affected or impacted by the COVID-19. Then we focused more on the providing the food and hygiene kit. So the food we thought in such a quantity that which can provide a ration enough for a family of 5 for 1 month. And then we identified who could be the vulnerable families where it can be distributed. In some of the locations, with the support of our partners, we also distributed milk for children for a continuous 6 months. And so if I talk about briefly that what strategies we engage, So definitely the first thing we took is that how we are going to repurpose our ongoing development programs on the ground so that they are able to respond to COVID-19 situation. As I already discussed about how we did touch base with them and food security with them. And then the most focus was that how we provide the messaging, the guidelines or advices coming from the World Health Organization and the government, and in the language where the children can understand. So this is some of the work, Vikrant, we have been doing on the ground. Yeah.
That's great, Avinash. Thanks for the share up and listening. So I think specifically gives them a more challenge context over there, as we're saying. Maybe it's the population density and the poor, the availability of the services like water sanitation. So Arvind, from the experience of IGSSS, can you also share which specific slum areas in which cities you are working? What are your experiences? How it's different from the pre-COVID context, and maybe some of very specific to services related to water sanitation or other, which you work generally.
Right.
How is it you're able to work around that in this context, in these slums? Over to you, Arvind.
Thank you, Vikrant. Much appreciate the initiative by Sphere India in organizing this. This is much needed also as we kind of go along. I think firstly, I will say that IGSS over the last good 2.5, 3 months, over the pre-COVID to now post-COVID, and now we have come to a stage where we are now more talking about with COVID kind of a scenario as we go along. So IGSS has managed to almost reach out to around 30,000 families, which translates to over a lakh 1.5 people through our interventions and projects. And this is primarily, we are talking about urban poor groups, but also means that there is a lot of most of our work area and people that we work with are living in informal settlements or slums, as you call it. And we have managed to do that. And while doing that, there were these reflection points that came as a response to your question, Vikrant. Firstly, our attempt was to also, we have to see that the past 3 months have been a evolution also. So we have to see that first our interventions were focused in bigger metros, and gradually what we have seen is that we have very smoothly moved towards smaller cities. So now I think in the last 3 months we have managed to reach around 20 cities and work in 20 urban poor communities, which means slums. So that gradation of cities was very clear and visible. Our strategy at looking at the intervention was at 3 levels. We looked at the individual level, where awareness and personal needs of a person was kind of addressed. Second, at the level of community, a lot of community preparedness became very important as we moved from the first month to the month that we are talking about right now. So that gradation was very important. Third, which has been our focus and forte, is how do we ensure that these needs and aspirations of people translate into policies. So 3 levels of interventions were very clear and to get simple. Other strategy and important point that we adopted very clearly was that, look, we will not be able to help or reach out to everyone. So very clearly reach out to the population groups that are in very specific need of what they want. And initially it was food, ration, basic things that are required. But as we go along, let's say with respect to waste pickers that we are working with respect to street vendors that we are working with, our response has changed because now the issue is of livelihood. So earlier it was food, now it's become increasingly livelihood, and how do we connect them to the existing schemes, mechanisms that are there. I think that is been very, very critical. And now when we know everything is with COVID, how do we really talk about preparation and preparedness for the communities? Something that we have not really done, and something that we have like just thought of and started to do and scale it across all these cities. I think that has been the kind of evolution of our interventions in the last 3 months. And yeah, I think that would be our intervention scope, and it's changed. Thank you.
Yeah, thank you so much, Arvind. And I think that's great work in a large number of cities you're working with. I think I'm still, getting excited is that in many of these places, I think in the COVID context, when the access itself becomes a issue, how are the volunteers and the staff and the workers they moving in? Are we looking at the personal protective equipment for them and their exposures to the high density of population over there? So maybe Kara, what has been your experience in how many cities and urban poor communities or slums your organization is working, and how you're also seeing while doing that, ensuring the protection of your staff and volunteers when they are engaging in these places. Over to you, Kara.
Thanks, Vikram. I'm just going to have my video on for a minute and then I'm going to turn it off because my connection's quite crackly. So just excuse me for putting my screen off. Am I audible? Because I keep getting a lot of crackles from my end.
Yeah, we are very clear to hear you. Please continue.
Okay. So as many of you know, TDH Foundation is a child rights organisation. So our work really focuses on ensuring the protection and well-being of children and their families. So during COVID, children, especially children from vulnerable population groups, we've seen have become almost like silent victims of this pandemic and the consequential lockdown, which we've all seen has impacted so many, particularly vulnerable groups. Through our partners, we are currently working in urban slums in West Bengal in the towns of Malda, Berhampur, Siliguri and Calcutta. We're also working in Ranchi in the state of Jharkhand. Aside from providing basic relief items such as hygiene kits, wellbeing kits, we are also focusing a lot of our work on mobilizing community influencers to disseminate key messages to break down stigma and also misinformation related to COVID. We're also conducting case management and psychosocial support to affected children and their families to ensure that their protection needs are addressed and met. But as you can imagine, with the lockdown, doing this remotely has been a challenge. We've tried to do this in those first months via phone. Now that we have some movement, we have staff entering the slums and still providing this care, but ensuring that PPE equipment is provided to families and also staff, and that a lot of these sessions are held in open spaces, but also in spaces where privacy is ensured. So it's obviously there's a lot of navigating this space with lots of new challenges that I'm sure we can all associate with. On a more of a global level, I'll share a little bit because we've also brought this to India. TDH has developed practical information sheets to support frontline workers and managers to ensure that protection of children during COVID remains at the forefront of our work during these times. So these guiding documents address things such as how to choose modalities of care within child protection services, ensuring safeguarding, case management, mental health and psychosocial support, and psychological first aid. Currently, with the support from UNICEF in India, we're having all of these documents translated into various languages found in India, and we will have these available as an open source for everyone to access in the coming months. I'll make sure that through Sphere and our other networks, I will inform all of you who are interested in accessing these. TDH has also been working on creating ways to ensure that we continue to fulfill children's rights to participate, with a special focus for children in confinement and lockdown. So as a result, we've launched a global initiative called COVID Under 19, which aims to bring together children, child human rights activists, experts and other key stakeholders, including the private sector, to work together in understanding what children are experiencing due to COVID-19, as well as their views in how we can address these issues. So we've developed a participatory survey, which was designed based on consultations we had with children in over 26 countries. This included India. The survey is now available as an online and also an offline format. For India, we have this available in both Hindi and Bengali. So if anyone's interested in having access to this survey, please get in contact with me. The objective is that we can reach as many children as possible, and based on the findings from this, all of us in designing further interventions around COVID, bringing the voice of children into those interventions. So that's a basic summary, but some of the challenges that we've observed for families and children living in slums is the digital divide and the impact this has had on families and most importantly on children, especially in regards to accessing online schooling. In addition, we've also seen, as all of you have seen, many families have lost their income as a result of the lockdown. And this has put families under immense pressure, which in result has also put many children at increased risk of child marriage, violence in the home and child labour. We are also receiving reports from survivors of trafficking and sex workers who are already stigmatised within their communities, who are now being further pushed to the margins of society. And as a result, we are hearing of many cases where such individuals are choosing to not access essential services out of fear, and therefore they're putting not only themselves, but also the community at increased risk. Another big challenge we've been seeing is that many of the quarantine centres do not have sufficient systems or resources in place, where there is inadequate or unequal distribution of food or a lack of, or poor sanitation facilities. And in many cases, protection measures are not in place. So for migrants who are returning, many are opting to skip these centres and are returning directly to their families in the slums, where, as we all know, physical distancing is simply not an option, which again puts the whole community at risk. So these are some of the work that we're doing and some of the challenges that we are facing.
Thank you so much, Kyra, and I think it's great to get to know about your work out there. Our next speaker is Ms. Roshni from the UA. Roshni, what's UA's approach in dealing with the crisis, the relief work in COVID? And will you suggest the ways of working in your upcoming days, especially focusing on the slums? Over to you, Roshni.
Yeah, thanks, Vikrant, and thanks also to Sphere India and UNICEF for organizing this. I think it's very relevant, and I'm happy that we have voices of organizations on the ground. I think that makes it so much more real. I think over the last 90 days, UVA has been very much at the front lines of relief work in 7 municipalities in the Mumbai metropolitan region, primarily. And, you know, overnight, even before the lockdown, all of our roles changed. So we have been looking at dry ration distribution to urban poor families, those who live in bastis, slums, which we say, cook meals to migrants as well as frontline workers. We've also been supporting migrants in arranging their journeys back to the villages, be it bus, train, all of that. And through this work, we've been able to reach out directly to more than 5 lakh people through this work. And we've also partnered with several organizations across the city, you know, civil society networks, campaigns to really make this happen. And all this work has been done, of course, within this lockdown period where there is health risks, but we've been careful to take whatever precautions are needed. Our teams have been, you know, tested and so on. So I think this has been the nature of the work we have done. I want to give you a small example, which I think encapsulates what this has meant over the last 90 days. Chandra and her daughter live together and they both work as waste recyclers. Her daughter got married but returned home because of domestic violence. They have 4 children. She has 4 children. So as soon as the lockdown was announced, obviously they lost their jobs. They had no savings and were absolutely forced to, you know, just whatever charity they received from NGOs, that was the food, that was all that they could survive on. The PDS, when it started coming out, helped her a little bit. But of course, since only 2 of their names were on that PDS card, they were never getting enough food. And despite work, you know, with the department to get their names back onto the list, this was not possible. So the whole point is that they have had enough. They just want to go back to work and get back to living a life self-reliant, you know. So I think that's important. The people who we have been looking at for relief are people who have been completely self-reliant, you know, and they have been forced to this situation, which is a very questions of dignity and rights. And I think the biggest thing that we have taken away is the impact of the lockdown has been felt the worst on people living in bastis, the urban poor, migrant workers, on their dignity and on their rights. And because they are actually invisible in our cities. But we've also realized that this impact is not just because of the COVID or the lockdown, you know, it is because of unequal and unjust policies that have been existing all along. It's just come into very sharp focus, I think. So for Yuva, always, even, you know, during this relief, it was not a question of whether we would get involved or not, but how and what would be our approach. That has been the big question that we considered. And for us, it was clear that a human rights approach to relief work and rehabilitation is very important. This is aimed at, of course, protecting the vulnerable, but not restricting to services and charity alone, but also building capacity and empowering people to assert and demand their rights. What does that mean at the conceptual level? It means you look at intersectionality of vulnerabilities. It's not just hunger. There are other issues impacting that. Also looking at partnerships with communities and community collectives in whatever work is being done. And very sharply identifying duty bearers and the need to make them accountable. That involves filing claims, monitoring entitlements, and looking at not just results, but ensuring ownership and participation of communities. I think at a conceptual level, that is what we mean by a human rights approach to relief and rehabilitation. In practice, that means that we cannot only look at issues of hunger. We will have to look at issues in bastis of water, sanitation, evictions. There were notices to stop evictions, but you can never be assured that that will happen. Healthcare, very important. Mental health, it's again been in the news a lot. And of course, education. So really looking at an integrated 360-degree way of working at the basti level, that is very important if you look at the human rights lens. Then additionally, doing whatever work you do in partnership with communities, whether it's in the identification, in the actual relief distribution. For instance, our youth groups have been so active throughout this phase, the children's collectives, the women's collectives. They have really shown us what they need and how we can support them. And of course, monitoring all the schemes that have been announced for relief and that will continue to get announced, whether it's larger policies and laws like the PDS or also the direct transfers and all of that, and constant negotiating with the government. So, I think this lens has offered Yuva, a very clear way. We are clear of why we are here, what we are intending to do. And we know that COVID is going to change the way we work. There is inequality in cities, discrimination, but we feel that only with a holistic integrated approach where you keep accountability at the center, only then I think we'll be able to overcome these times.
Yeah, thank you so much, Roshni. And I think you very rightly brought it out. It's not about just the hunger. It's about the water, sanitation, education, other healthcare and mental health and all other essential services. And one very important component beyond hunger is also the nutrition, I think. And nutrition also especially for the more vulnerable groups over there. And we have seen the hunger has the long lockdown has greatly impacted the hunger situation with not just the migrant workers. We have visible stories, but then there are the urban poor where we may not get enough coverage about them, but then it has gravely impacted that. So we have with us Snigdha, who works for Action Against Hunger, and is one of the organizations which I've worked closely on some of these very specific nutrition-based interventions. So over to you, Snigdha. What's your experience of working in the slums? Which are places you are working with urban poor, and how you see that the nutrition-focused interventions can be taken forward in these times? Over to you, Snigdha.
Thank you, Vikrant, and thank you for organizing this lovely event. I'm very impressed with all the work that my earlier colleagues have spoken about. It always makes you feel so good and uplifted when you see other people doing a lot more work and so many people interested in hearing what can be done. So yeah, it just puts a bright smile on my face just being here. Uh, you know, Action Against Hunger does both rural and urban slum work. So for us, it's very interesting because we have this whole lens of one versus the other. To recap the kind of work that we've done, during this pandemic scare. Oh, yes, we did. We did the dry ration distribution. That was one of the first things that we decided to do. We were in the last 3 months, we've been able to do around 18 tons of dry ration distribution only in the Mumbai slums. So we work in Govandi and Andheri slums. We've also been able to actually do. We distributed around 1.2 lakh protective care and sanitizers, etc., to the frontline workers, to the police department, and also to some vulnerable families, to be able to actually start taking care of and be able to go ahead and do their job that they're supposed to. We did, like, what Avinash ji was mentioning, and also I think what Arvind mentioned, that slowly it's all becoming about not pre and post, but with COVID, and how Avinash ji was mentioning that we also went through this whole rigmarole of figuring out that what does it mean for Action Against Hunger's programs to continue to be alive and continue to be relevant while this is here to stay, and this the virus isn't going anywhere. One of the first few things, I think we were few people who were really quick to do that, is we started doing video and telephonic counseling of people. So, answering their questions, figuring out what uncertainties that they were fearing about, giving basic nutritional care messages, especially to new mothers. We started moving all of that to video and telephonic counseling. I think we've done around 4,000-5,000 calls till now in the last 2.5 months. While a lot of this relief work is happening and will continue to happen, I think our overall target is to achieve around 100 tons of dry ration to be distributed. While we continue to do that, I think, as Roshni very rightly said, that the question also becomes that these problems existed before as well, and it has just now it's become multifold. The crisis has become a super crisis now. Nutrition, especially in the slums, children, uh, all the issues related to the slum living were already existing, and we were already overstretched. I don't think so any of our colleagues could say that, oh, we took a target and we were satisfied with it. No, everyone was overstretched. And now I think it is on us and everyone else to see that how do we get out of this stretch mode and make it our new normal, as a lot of conversation around that's also been happening. So we're also moving more and more towards not only including COVID as a relief measure, but actually including this or any other pandemic or all the related problems that come along within our long-term program. So that is our big plan, that how do we weave everything together and have an integrated working and have an integrated offering to the population. Yeah.
Yeah, that's good. I think that's definitely the one of the way forward is to look at how we have an integrated offering to the affected people, more part of the vulnerable groups over there. And among the vulnerable groups, we have a lot of marginalized communities. Also, I think though they say that the equation changes in the urban context, but within the urban context, within the vulnerabilities, the complex vulnerabilities. And the one organization which we work very closely on with some of the most marginalized communities and the vulnerabilities is the Kaitas. And we have with us today Lisa. To Lisa, over to you. Will you please share about where you are working in with the urban poor, and among them, which are the most vulnerable or marginalized groups you are working with there? What are your challenges and issues out there? Over to you, Lisa.
Thank you, Vikrant, for this. And I would like to thank Sphere, HCL, and UNICEF for organizing such webinar. And we are here today, we are talking of a population, I would say 17% as per the census of India, is the 17% urban population, especially the people who are living in slum areas. So that's where we are here today to discuss on this platform. Caritas India being a national presence, we have with 200 plus partners. We have worked or reached out to all the cities and as well as urban and rural areas. To say just the number, along with some of our church agencies, we have reached around to 13 million people during this COVID-19 response with our response. So that's where we are. We have looked at some of the components, if I say like, as many of the organization before they have said. First, we came out with basic need, meeting the immediate need as per humanitarian crisis is a health crisis which came up. So the immediate need of the people that was provided across the country, especially in the cities, as well as the migrants who were moving. So that basic needs, food, water, sanitation. So we also engaged with some cities, with the government department providing, opening up the community kitchen. So in Delhi, we opened 2-3 community kitchens. So that's where we engaged initial part of it. Then later on, we went with the dry ration, providing dry ration to the people, hygiene kit to them, PPE kit to the people, the frontline workers. So these are some of the basic need that Caritas India engaged with. Coming to the second point, we also engaged with looking at psychosocial counseling. We came up with helpline number Caritas initiated, and then we were providing also through our partners across the country to the people. And that's where we realized a lot of issues were coming up with the challenge of the migrants, some feeling very low, depressed, job loss, and the children's issues, so all those that we were providing. The third part, what we also engaged was research. So as I think IGS has said, that policy level engagement also was done. We did a study on migrants, returnees, a rapid research, and just to tell that this was taken as when the affidavit was filed in the Supreme Court, it was taken by the People's Collective, the research findings, some of our research findings which spoke about the migrants, those who were in distress, the migrants returning. So that's some of the part. The coming little bit of the challenge, from challenge two parts. Challenge from our side, what we felt, especially engaging in the urban community, was that keeping the social distancing, and also how they have to come out for the distribution. We had to organize some other place, the distribution part of it. So that was a challenge, like even community kitchen, or whether it was dry ration distribution. So people have to come out. So we have to have some mechanism developed outside, bringing people distribution. So that distribution was bit challenge from our part, from the staff part, what was felt. But we also came up with the guidelines for the staff, safeguarding of children. So all those mechanisms we came up with. The challenge from the people's part, I would say, I would look from the three what the struggles people had. So first was their health. The health perspective, water, sanitation, hygiene. We are here talking of COVID-19, where you need to wash a lot of your hands. But in the urban slums, many of us, I have worked for 6-7 years going to many of Delhi's slum, almost all slums. We have seen the situation in the slum, how the people live. Social distancing, we are talking of social distancing when in a small room, 10 people live together. And there is no water tanker comes in, and that also not very regular. There is no pipeline water in the slums. So these are the challenges like water, sanitation. So health issue is a big, and COVID-19, we are here to talk of health crisis. So that's from one perspective. Another is that employment. Many of these migrants are into unorganized sector who are placed, and then they lost their job. They lost with the sudden lockdown, the unprecedented measures which government came up to curb this, the spread of this. So a lot of challenges people face, they lost, especially the vendors, especially the domestic workers. We all of us know the challenge that they have faced. The unorganized sector people who were working in the construction sites. So all they lost their jobs. So that's a big challenge that people have faced, the urban people, especially the people in the slums. And then the third one I would say is the social issue, which is the discrimination that has been felt by the whole COVID now. It became like divide. Initially we discussed, sometime it came of the religions, this disease. Now it's like a social disease. So it's like somehow this people felt the discrimination of the from this part. Also, the people living in the slum part of it, the whole containment zone, and how the people dealing with, and when these people also went back to their villages, the migrants. If we talk of the slum, there are migrants who live in the slums as well as seasonal migrants who are there. They went back, they felt a lot of discrimination, which our studies showed as well. So I think these are some of the challenges, and also social challenge. One of the, I would say also, is that depression. The children engaging into, they have no online. I think Kyra has also spoken about that. Online classes, I think digital divide that is there felt in the community by the children, the education online. So now how these children are engaging with. So mostly they will have more time, and we cannot do any activities in the community, engage with the children. So these children engage with some other social different activities. We heard also like in drugs, and also in the Lucknow, I heard they are more engaging now, and then also with Tash, Jua, all these. So these kind of, and then domestic violence. So I think these are some of the challenges that people have faced in the slums. And I think we need little bit very comprehensive plan, not just people in the slum. It was there. It is not that something new, but I think it has become more visible with this COVID-19 now. And we have to come with some of the plans, long-term engaging with the community there in the slums. Yeah.
That's great sharing, Lisa. And this is that very rightly saying, bringing about is not just the direct relief work, but a lots of other advocacy also. And I think hearing all of you, all the good work being happening from the front end organizations, which you all come from. I think we as a platform also see the next, scaling of the work happen through a good advocacy with a set of stakeholders. And as many of you also spoken about, it's learning from the experience and doing the research over that and informing it back, to the various stakeholders in terms of what our advocacy and advice is all about. So my next sort of a question maybe I would open up is, I think within slums, we're working with a very wide range of stakeholders over there. Uh, maybe to go back to Avinash, from Save the Children. So Avinash, what's coming from very, very child focused and child specific issues and some essential services in these urban poor communities. So what's your advice to and how you think you can make better use of opportunities coming through, like the institutional mechanism for child protection over there, DCPCR and others. So what's your advocacy for them? Over to you, Avinash.
Yes. So thanks, Vikrant. And so from where I see from a childless perspective is what we need immediately when the government is planning that they are thinking about opening the institutions, the health institutions and the education institutions and facilities for children. So definitely we need certain guidelines that how these institutions are going to function, because at the organization level, we have prepared a guideline. We have already shared with the government that this could be some of the ways of looking at how these facilities going to be reopened and can be used. But we need to see that how the government gives a broader guideline encompassing all the institutions which actually deals with the children. Second aspect, which I see that the focus has to be there on preventing the spread, because now the spread is on a rise in every location. We are getting, and more specifically for the urban locations, if you see. So from there, Vikrant, I see that we do have some very good examples of the rural development. We can say that we have some good models maybe developed by CSOs with the support from government. When it comes to the urban programming, so we really see that kind of a modeling happening in the urban locations. There would be there, but not a very prominent that I'm aware of. And here I see that in the context of COVID, we can see that how Dharavi is upcoming as a model here, where the spreading is going to be very less now. They are trying to have a control. So we can learn something from that how this is going to be happen. Maybe that can be replicated everywhere. And then I also look at this point of time. So most important aspect, even as an organization for us who work for children, we are looking how the food security and livelihood of the families. Because if we want to secure the children, if we want to secure the children, then we need to be focusing on the families entirely. So that's the point where I see that in the coming months, we are also now trying to move from relief to recovery, an entire journey, that how the livelihood can be also be ensured. And if you ask me, Vikrant, so I completely agree when Professor Amitabh Kundu, when he says like, no, it is high time that we have an urban employment guarantee scheme on the similar lines of the Manrega. So there is a need of focusing very strategically on how we are going to restore the livelihood part, unless that it will be difficult, because we see children along with their families, not a kind of a separate from their families. So unless we restore the entire family in position, securing child rights would be a very distant dream, to my opinion. Thanks, Vikrant.
Yeah, thank you so much, Avinash. I think you really brought up some of the pertinent points, like looking at the urban employment guarantee scheme, and maybe also specific to children thing. And another child-based organization here is we have with us is TDH. Maybe Kyra, from your perspective also, I think you shared about that you're working with the private sector also. So do you have anything to offer your advice for the private sector? For getting involved more with the urban slums and the children issues over there?
Yeah, no, so we're not working. I mean, we're trying to engage with the private sector with our interviews, but in terms of our direct work in the field, not so much with the private sector. But in terms of advocacy and areas of work that we feel need further focus, we feel that advocacy on protection and education needs are deeply required, like I mentioned earlier, as did the digital divide is having a huge impact on the well-being of children. So here, I think it's really important working with the Ministry of Women and Children, the district child protection units, and the ward level child protection committees is essential. So we need to be working advocating at all levels. As we know, the ward level child protection committees are responsible to ensure the needs and protection of children at the community level. However, we also know, or those of us working in child protection know, that in many instances, these committees are not functioning well or simply aren't functioning even at all. However, TDH feels that this is an opportunity for NGOs to really gain a better understanding on how these committees are responding during this time, and how we can provide support to strengthen their role and positioning within urban slums communities. So one way that we're doing that is that some of the children that are engaged in our programs, they are now active in these committees and have been really active during this COVID time in bringing out and sharing key messages, helping us design interviews to engage child participation, and also identifying returning migrants and making sure that safety measures are in place. So there's lots of ways where we can try and engage with these and strengthen these existing models that are in place that certainly need strengthening. We also feel like there's a great need for strength and joint advocacy at all levels to ensure the safety and protection of children from the more vulnerable population groups, such as children of sex workers, survivors of exploitation, and children with disabilities. That's just to mention a few. So some reports we're getting, survivors are saying that they're coming up with symptoms of COVID, but because of the stigma they're receiving, they are choosing to not go to healthcare facilities out of fear. And this is really sad. And so this is where there needs to be a lot of advocacy around the protection of all groups, of all population groups. And like I mentioned around the quarantine centres, I think there really needs to be strong advocacy around ensuring quarantine centres have protection mechanisms in place. You know, there are so many cases that we're hearing of migrant workers returning to slums from other urban centres and opting to go directly to their home rather and skipping these centres because they don't trust them. And obviously this is putting the whole community at risk. So we really need to be working to make sure that these quarantine centres are safe and definitely have protection mechanisms, as well as all your basic amenities like water, adequate food, adequate sanitation facilities, and all of the reports. And from visiting some of these centres, a lot of them simply don't have this in place. So these are some of the big areas that we feel need a lot of joint advocacy, and obviously looking at it from a protection lens. Thanks, Vikram.
Yeah, thanks so much, Kyra. And I think you rightly brought up, I think the working with these child committees and the protection of their and advocacy with the various government wings at women, child development and others. Arvind, I understand you also work with either the partners or maybe the community level CBOs and other structures. uh, what kind of these CBOs are there, in these urban poor communities where you're working, and what's your advocacy that how you can do it better with their help and the other counterparts? Over to you, Arvind.
Thank you, Vikrant. I will actually just connect your question to what Avinash ji had put up earlier. So exactly a month, or no, actually 2 months ago, Dharavi, the way it was kind of portrayed in media, in everywhere. Oh my God, Dharavi is this hotspot. We are going to lose it. It's going to, I mean, it's going to be the next big crisis that we have seen. So that was the case, and now we are talking about Dharavi as a model. So we should actually just interrogate of why did Dharavi do better, and as compared to, let's say, other areas which actually helped or aided in the spread of the COVID virus. So Dharavi has a robust, excellent community network, and people are Atmanirbhar in that sense. So there is a very strong community network. They've already been very organized, and ironically, that organization has happened over the last so many years, but very recently now, as they were coming together to oppose a redevelopment proposal. Yeah. So we also have to understand the history of the community and how they've come together. To come to your question, Vikrant, very clearly, I think in our interventions and in our work and through our partners' work, what we realize is that wherever we have succeeded the most now in this whole juggling between work from home and hitting the ground, it's actually been the people and their community level collectives. Wherever they are strong, wherever they are much organized, wherever they are democratic in their working and functioning, wherever there is a structure to that, the people have done really well, and the relief efforts have happened really well. So I think when we kind of go ahead from now, because this is not ending now, this is going to go on for a long time, I think what we really need to work with and focus on is people and people's collectives. Our CSO's work is going to change. It's absolutely going to change. We are at the moment looking for spots of distribution, but going ahead, that might not be the case. I think it has to be people led and people driven. And this pandemic and the efforts that we have took here and there in places have made us realize that people and people communities and collectives are the most important things to take forward. The other thing that is very interesting, and I just want to kind of hint at, is that we also in this struggle of doing our work, we also have to keep in mind that the state itself, I feel, I might be biased in many ways, the state itself is lost on what is to be done. It really doesn't know what is to be done, and we also probably don't know. But I think our strength is that we are closer to people. We are working with the communities that we are. Our responsibility and onus now is to how do we take that message and take it to advocacy through research, through fact finding, through assisting them and our state and authorities in making policies that are relevant to the ground. I think that is going to be critical. One last point, Vikrant, is that the pandemic has shaken up the status quo. It's like shaken our notion of city, society, so on and so forth. This is a very good time to ensure that the philosophy of our work is also changed because of this. I'll just give you one example. Why are we just talking about slums? Look at the resettlement policies or state-led housing policies for urban poor. They're actually worse off than slums. Yeah. So this actually gives us an opportunity to make those radical changes that we have always wished to, and not just look at slums, but also look at states lack of intervention in something that has resulted in slums. And I absolutely shy away from using slums, because I think that's sort of a direct, I mean, it's a word that we should not be using. which is why we use other terms that we have to kind of take it forward. Last point is that we really have to also think of like, for instance, disaster. It was never thought of in this way. So we have to like get over the fact that we can do patchwork in our cities and really understand that unless and until we talk about disasters, inclusion, so on and so forth, these things at the city level, that means city planning, that means city budgeting, that means urban design, many things. Unless we talk about the city scale right now, I don't think we would be addressing those issues. So I think we have to nudge ourselves to also come and change our practices as well.
Yeah, I think very aptly you brought out Avinash, and I think you brought a very strong statement also. I think the state seems to be somewhere lost about its there is, and I think state need to benefit from all of our experiences also, and that's what the advocacy and the collaborative advocacy is all about. And there's been some very good insights and good pointers coming towards that. So, Roshni, as I think, again, we're talking about Dharvi and other slums in Mumbai. I think that's what you said. You also have been closely working there. And while Avinash did share about, Avinash and Arvind did share about, the Dharvi as a model, we've seen because of a very strong community networking existing over there. Now, where do you see the government, especially the local level government, local self-government, intertwined with these community structures, and what's the role they have played, and what's our advice to them to do better? I think, of course, maybe you can also say about, as with, if I go by the Arvind statement, his state seems to be lost. So what is our advice to the state? What can be done better about this? Over to you, Roshni.
Yeah, thanks, Vikrant. I mean, I think the speakers have covered a lot in terms of, the inequality and the discrimination that exists in cities, and how really bringing people together, building their ownership, and, looking at accountability very centrally. That's the only way we can, tide over these times. I want to again just give a very quick example of Binoy, who was one of the people we met when they were going on one of the nakas out of Bombay. He and his friends have been in Bombay for the last 3-4 years. They're from Assam. They worked in a zari factory. The employer had not paid them since February. The owner threw them out in April because they could no longer afford the rent. So whatever money they could scattle around from NGOs, they bought 2 second-hand bicycles, and 4 of them were going doubles all the way to Assam. Now, this is a story that, we've heard, but when you see it and, when you meet these people, it changes the way you think. And they would beg for food, water. They had no real plan. All they knew was that this city had rejected them. This is a city where they have been living for many years, but it had rejected them. So I think, the big question for us now is, how do we ensure that those who are essential to the city are also valued? I think that is the important question. And most of them, yes, they might be living in bastis, they might be homeless, they might be living in resettlement colonies, but primarily these people are essential when you look at the city imagination, and how can we make sure they're valuable? And I think that this whole one thing that has taught us that how do we find this and how do we make this into, maybe an opportunity? Like even when the plague happened, we all know that post the Bombay plague centuries ago, we had adequate housing was suddenly a big issue that was being spoken about. So I think really look at that in in that light, look at it in that lens, and talk about moving from this immediate relief to larger scale rehabilitation and empowerment. And for that, I think we need to look at multiple sort of areas of work. One is, of course, a big housing issue. If we look at cities and urban poverty, urban poor people, then, of course, a labor issue, which Binoy's case clearly highlights the way that people have no job security, wage security. Then, of course, planning and governance, which other speakers have also touched about. Then we are looking at vulnerable groups. Kyra also mentioned how specific groups like children of certain sex workers and others become much more vulnerable. I think there have been some questions also on housing. So I just want to spend a little bit speaking about that very quickly. I think, of course, the evictions the forced eviction that happen are what really debilitates people's lives and their livelihoods. So this must stop at all levels. And also declaring slums, where you notify a slum, that really ensures that the municipalities have to give them basic services. And this, I think, is very important. All states have slum acts. We really need to work to ensure notification of slums, surveying, declaring the land that slums are on as, as housing. And another issue, another question that came up was also of densities. I think this is very important. There are guidelines, but obviously they're not followed, especially like Arvind said, in the resettlement colonies. I open a window, I can, look into somebody else's balcony. I mean, I think this, in terms of when we have these sort of health crises, we already know TB exists at a high level, but COVID though will spread, so I think really re-looking at issues of density, I think is very important, but also in cities, the majority of people are also rental housing, so I think we need boards to regulate that. There is conversation going on about that as well. So I think we look at the habitat, there is a complete slew of things that we need to work at different levels. Similarly, I think people's participation in planning their own city. People, I mean, in a city like Bombay, we have 60% people who are living in bastis and related settlements. So they have no right in terms of, they have rights, but which are not implemented in terms of planning their own areas, whether it's the 74th Amendment, where you really devolve powers. I mean, I know these are at one level, they seem idealistic, but I think this is a time that we very strongly push for these things, because without this, we see what has happened in front of us. Similarly, labor, I think there's been talk of for urban poor communities really looking at sort of a Manrega model in cities where you have, assured employment, and also looking at building social infrastructure through that, whether it's toilets, whether it's sanitation facilities, so on and so forth. So, I mean, and if you look at the SSG model, if that was strong in many of the states other than Kerala, maybe we wouldn't have, the people that we work with wouldn't have suffered so much, people living in the bastis. So I definitely think people-centric, but strong accountability from the state, and looking at a slew of issues which affect a person who lives in a basti, who is urban poor, and who is most often invisible in the city. I think overall that's the real approach for us going ahead. And I know all organizations have their specializations, but then that means we really have to work together to each of us bring in our weigh in on what we are able to do the best.
Yes, and I agree with you, Roshni. I think everybody has got their specialization, but that's where I think the last part of it comes up is coordinating everybody together so that we cover all issues, everything together in a more integrative way, and also look at our collective accountability, in a holistic manner. Thanks for your sharing, Roshni, and I think we'll move towards our next question to the colleague Snigdha, and also there has been a question for Snigdha from among the participants. Also, a list has come to me from Navila. So, Sunita, again for you also, what's your advocacy to these other stakeholders? And I will, merge one more question along with that is, for the advocacy, is there any concrete evidence of degradation of nutrition status in slums due to lockdown and the COVID-19 crisis? Is one of the participants, Tapan, has asked about it. If you can share about that also. Over to you, Snigdha.
Thanks, Vikrant. Let me quickly first answer Tapan's question. So, we also did very recently, we conducted an internal survey in all the geographies that we are present in. And there were these multiple breadth of questions that we wanted answers for. And we also wanted to understand that what is the, what is the real need of people, and are we doing things blindly, or are we following a structured path? Some of the key indicators that came out of this survey. So let me give you an example. That in Govandi, there was 90% of the population of the people that we surveyed, 90% people reported a loss of 100% loss of income or zero income. Now, if and in Andheri slums, there was around 70 or 80%, actually 80% loss of income that they reported. 80% people reported zero income. If you think about it like that, that automatically means that providing nutrition or providing the right kind of food for the children, it's a direct impact that becomes a challenge for these families. Similarly, we also did an entire a stress test. And in Andheri, the stress levels and the frequency of these stress levels were pretty through the roof. 60 to 70% people said that they were experiencing high stress levels 4 to 5 times a week, which is, I don't know how anyone can, to handle these kind of stress levels. We also did an income indicator and realized that a lot of people have already finished their savings and were now dependent on debt. Another indicator that we looked at was food insecurity, which is a direct evidence. And in the Govandi slums, we saw 70% were food insecure, and 36% of these were actually severe food insecure families. So similarly, another data point that I can throw is that 60% of the severely malnourished children, only 60% could get the RUTF or the EDNS that was required, and even which also we participated a lot in actually making that happen, and even we were not able to reach the remaining 40% children. So these are multiple indicators that actually can show that there is obviously a crisis. There's obviously a high level of food insecurity resulting directly in the degradation of nutrition levels of children. So I hope that answers Tapan's question. I can continue and I can talk a lot about the data and other anecdotes and other similar stuff, but I think that should cover it all. To actually come to the larger question at Vikrant, that what is the kind of advocacy that we are hoping, I think most of it is already covered by my colleagues over here, and there isn't anything different or anything anything that I would like to oppose or add to, except for the fact that I personally feel that these are times that none of us had ever imagined, and these are so unprecedented that it's absolutely okay to be at a loss. I think to have expectations that someone will have a magic wand cannot be. I think compassion is the answer. Collaboration is the answer. Yeah. I think Roshni mentioned that we all have our specializations and we need to, we need to collaborate more. Yes, and I think we will see such interesting collaborations in the future that were not on our plan. We will be seeing a tremendous mindset shift. At least that is the hope, and that is the advocacy that we should also be saying, that we need to really let go of whatever past hangups we all had, but actually move to saying that no, what is the best that each of us can do, and have, unless we can all think about a holistic picture, and it is a great opportunity. I think even Arvind said that it is a great opportunity to press the reset button. I think that is where my request to everyone, my advocacy to all stakeholders would be, and everything else that all of you already mentioned.
Yeah, I think that's I think Snigdha, we certainly, this is a time when you look at resetting and need a more collaboration and perhaps more coordination, more cooperation, all going on together. I think it's what also coming from the Roshni also almost sounding something, and everybody in fact to say there is. Maybe I think we last hear from Lisa also. So Lisa, again for you, I may try to merge one of the questions from the participants. It's all about urban. Say urban is already densely populated area, and is there any criteria for population density in slums? If I go more sensitive as what Avinash was which Arvind was saying about, maybe in the urban poor pockets. So is there any criteria in terms of population density? How we should say that is number of household per acre? Maybe you can share your view about it and also link it with the collective accountability. And yes, then as from your learnings from your work, I think your Kaitas work spreads over lots of geography. And coming up again, some of the evidence you pick up from your work, and based on that evidence, what's your advocacy to the stakeholders? Over to you, Lisa.
Thank you, and thank you for that question. I'm not very technical into that. What should be the density where people are living in the population-wise? What should be that? But currently, what we see the trend is that urban population is increasing comparatively to rural because of the job loss in the rural areas, and also a lot of the agriculture laws, the people are not able, so they are moving for the job. So there we see that lot of even Delhi, Mumbai, and many other metropolitan city or cities in other way, it's increasing. And the slum areas that we should not say slum or resettlement colonies where people live, it's that lot of it's very densely populated. And I was reading there is a 1 square meter area where people live, so many like 9-10 people, and Dharavi is another example that we have 200,000 people living. So it's that kind of this, and so that's where we are with the densely, and I don't know what should be the criteria. I'm not technical expert into that, but I think everyone needs a space to live. Space now for children, if you are in a family, children need space, family, the parents need space. So that kind of criteria should be there and developed by the government, local government, I think, when it comes to the city, and the space where people can have the safe space to live in. And when you look at the migrants living, the urban people, the rural, the people in urban, the slums who are living in, the areas are very, very populated densely, we all of us know. So how can we create that kind of space or do the advocacy for their housing? So something government has to come up with or include them, like Arvind and others have spoken about that. Creating a very inclusive urban planning, urban development plan has to be there, and we need to advocate for that. Coming to another question of the advocacy, with my experience with the grassroots level, what to government now recently with regard to COVID-19, the government, the Ministry of Urban and Slum, this urban ministry, home housing, they have come up with one advisory, and then health ministry has come up with another advisory to the slum community, one on the doing on the in the slums to prevent the spread of the COVID-19, and another from the advisory which has come to look for the sanitation and hygiene in the community. But there has no been any strategy or guidelines how to proceed with, how this water sanitation will be provided to the community. So there we need to do advocacy as a collective, all of us, how they should be provided. This one is water. When we look at water facilities, sanitation, what Caritas did in some of our areas, we put that the mobile water tank, like a mobile water washing spaces we created where people could wash and kept the soap and all that. We need to look something like that when the tanker comes, how there should be some monitoring system or the pipeline water facilities in the slum areas where people have access to water. So that's one where we need to look at when we are talking of water. The other thing is that now the pregnant women, lactating women, and the other normal diseases like in the community, people are no vaccination is another, it's stopped. People are not able to get, children are vaccination is all. So how the primary health centers have been enhanced or look for the facilities that been there so people are getting to the normal medications and their needs of the health are met. The third, when we look at that, can we advocate to say that now government has come up with giving them little food, little ration, but that's not. Can we advocate? I think many organizations are already advocating for 6,000 rupees for per family, irrespective of whether they have ration card or not. So it should be provided to everyone, 6,000 rupees, looking for one family expense. That's very concrete that we can do advocacy. The other, what I'm looking for the advocacy is that can we do now, when we look at the 1995 Construction Workers Act, it speaks about cess. So the cess which has been generated, it is with the board, Labor Department. That's now we need to advocate that this cess needs to be released and given to all the workers, the construction workers. So since they have lost their job, they should be able to access to this cess money which is there in the department. So I think these are some of the things which we need very strongly to advocate. And also for the education of children. We do not know now how long this education is going to be stopped now online. How can we need to come up with very strong strategies, Save the Children and Kyra was speaking about, and other organizations who are working, how we can do advocacy for online. If there is no access to that, how can we engage? What we are doing in Caritas is that we have created peer-to-peer learning, and children are tracking peer-to-peer tracking the children. They are helping them and to children like that. So something, that kind of mechanism we have developed within our programs. So I think something that, and of course I would say at the end, what we are seeing within our own organization now, there is a lot of coordination and networking happening. So as some of previous speakers have said, that this is real time that we need to really cooperate and coordinate, and it will happen and it has to happen. We need to work together. So I think that's where I close, saying that all the organizations, corporates, also need to come together in line with us. And I want to appreciate and thank HCL is supporting also us a lot into this program, means reaching out to the people. So we need to come together hand in hand and support. So that's what I think. Thank you.
Thanks, Lisa. I think that was really very, very elaborative about most of the advocacy issues, and I think also from all of them together. So maybe Arvind, will you like to also, or maybe anybody else would like to take on this question in terms of, the density, what kind of a density is the slum in terms of number of household per acre? And also, which type of roles played by elected representatives, the councillors, mayors, during the COVID in slums, what's that, and what's our specifically advocacy for this particular group of people for their better engagement? So maybe it's open to everybody, who would like to take on these questions.
Should I take up the density part and then leave the other one open?
Yes, please, Arvind. Yeah.
So I'll just take the density part very quickly because it was coming up, though my work in Bombay was a little while ago. So, but what I remember from the Bombay rules, and also the one that I remember from my Delhi master plan engagement and the density standards that are offered there. So the density standards in Delhi master plan and its redevelopment is around 900 units per hectare. Yeah. And in Bombay, the basic minimum for a SRA redevelopment is that you need to have around, you need to have around 900 units per hectare. That would be further densified because there is a model that we are following of making vertical arrangements for the slum dwellers and also having a free sale component. So essentially, our problem with housing, sadly or unfortunately, because we are stuck in this redevelopment mode, up till now we have been, COVID might change that. Our push should be towards that. Pre-COVID, what we have been doing is that we just redeveloped, and we thought that going vertical is the solution for everything. And that is what is resulting in apartments that do not have light, that do not have ventilation, and that cannot be called as fit for human habitation, which were increasingly visible in the number of cases, TB cases that were coming out in the resettlement colonies of Bombay. And it's a pattern that is followed. If investigated in other places, I'm sure it'd be more visible. Now we are talking about density is only because COVID has come and we realize that, okay, that's not going to be restricted to one locality. It's going to impact a bigger society. So what we really need to do, I think, is to change the housing approach to housing from a redevelopment model to rehabilitate, upgrade, or if required redevelop, only if required redevelop, but the density should not be increased in the guise of using prime urban valuable land for increasing development and construction. We cannot increase densities. Someone has just commented, Tapanji is saying it has 8 lakh square people more in Dharavi, or actually they say it's almost it's 2 square kilometers and it's a million population, right? If Dharavi model, redevelopment model were to be implemented, that density is only going to increase. Yeah. So we have to really think of how are we going to challenge this redevelopment model. One. Second, that housing is a continuum. I am not in a position to buy a house in Delhi. I'm sadly not in a position to buy a house in Delhi, and I would not be in a position to buy a house in Delhi because the house rates are high. And for anyone who's not making that much of money, there has to be a rental market. There has to be shelters at the barest level. And even below shelters, there have to be emergency shelters in our cities. So how are we looking at someone sleeping on the street to a low income person to a EWS and then upwards? That we can do. But unfortunately, what we're seeing is that we have vacant houses in our cities. No. So those are the issues that we have to address. Unless we do that, unless we press that reset button that our colleague Snigdha spoke about, unless we do that now, I think that's going to be a big missed opportunity. Last point before we go there, I was also thinking that while doing that reset button, I think civil societies somewhere have to kind of reach out to the people. People by mean actual civil society. Organizations like us who are working or we earn our bread from the civil society sector, but our civil society is not that, it's people. So this time around, while pressing that reset button, what we think should be done is that how do we engage with people and make it civil society, the vibrant civil society that we should be, rather than just professionals, rather than just experts who are thinking that they know answers and solutions. We have to get people part of the civil society board and then kind of take it forward. The reset button is much required. Thank you.
Great. Thanks a lot, Arvind. I think that's really very helpful. I think specifically able to get to the point of the number of households per acre also. I think those lots of things to think about, and also in terms of what kind of a civil society we need to be. I think right. So it's time, I think I open up the questions from the participants directly also. If anybody among the participants want to ask a question, please raise your hand over there, and we'll help you unmute and put your questions directly. While I got some questions from the chat, and till we see the show of hand from somebody, I think I'll put up that question again. So I think the question was about the role of elected representatives, the councillors and mayors during this COVID situation in the slum. So maybe, is there anyone among the panelists who would like to answer this specific question?
Yes, Vikrant, if I can.
Yeah, please, Lisa.
Yeah. They have to play a greater role, elected representatives. If we can learn from the examples of Kerala, what they have done, that the government there has empowered the local governance, the municipalities, the
Sorry, I think that was accidentally unmute.
Yes,
Lisa, you can continue with your question.
Yes, so I was just speaking about examples from Kerala, what's happening, and we see the results in Kerala to to combat this or to prevent the spread of the COVID-19 is that the local governance had been strengthened there at the local level. So the municipality, the councillors in the slum areas, the representative councils, they have greater responsibility to play, and somewhere the state needs to give them more power to do that. Sometimes it's that because they're elected, they belong to some political party, and they are not very much empowered to make their own decisions, or maybe sometimes it's with the party remains. So I would say they have so much greater when it comes to water, when it comes to, they have to maintain that whether water is coming to their own local areas, the health facilities are there, people are able to access to that, food is there. So the money comes also to the local representatives. If you are speaking about the local representatives, they get, like, if we can say, the members of the parliament of their local area, or the councillor, it must be, they get, the money comes for them for the development of their locality. So I think they have a greater role to play in terms of building health facilities, in terms of providing the food security for the people. Now employment opportunity, how can they are going to do the employment opportunity for their people. So I think, yes, they have to play.
Great. I agree with you, Lisa. I think we see a model like that in Kerala, where there's more money goes to the Gram Panchayat and the local self-governments, perhaps as compared to any other state in the country. But that could be one way where the local government, these local representatives are more empowered through money and other resources in revenue sharing. But maybe again, through elected representatives, they, being the people's representative, they have an access to the places and the voices. I think that's also where they can bring a lot to their own advocacy and influence, for the people in their respective areas who elect them. Thanks for that. I see a hand raised by Professor Sheila Mishra, and I'm opening it up for her. Ma'am, please ask your question.
Okay, thank you so much. And I must congratulate you to choose this kind of discussion. It was really very informative. And we as an academician sometimes wonder, like we all know that the women and girls, they are the worst affected people when any kind of disaster comes. And especially when the social distancing and all those kind of preventive measures, which also are in a way burden mostly on the women in the family. And when we talk about slum, it is really going to be very, very difficult for women to handle this situation. So I would just like to know what could be the strategy so that the women at least can suffer minimum in this kind of situation, because gender mainstreaming and minimizing their anxiety, their problems, their difficulties, that is a great task now in front of all of us. So I would like to know something about it, the impact and the how the women may be helped in such situations. Thank you.
Thank you so much, ma'am, for your question. Anybody among the panelists who would like to take on specific, I think, gender and a woman focused question?
I mean, I can take this.
Yes, Roshni,
I
please.
think, is that okay?
Yeah.
Professor Sheila, absolutely, you hit the nail on the head. I think already this intersectionality of vulnerabilities, which is most evidently seen in women who are also contributing to the labor, contributing to the home, contributing to health, contributing to nutrition, contributing to childcare, and the invisibilization. I think, the urban poor as a whole have become invisible, and the women, urban poor women living in bastis are even more so. I think, again, looking at the Kerala model is good because that's local. I think the way in which women are organized, I think that is absolutely important. The collectivization of women is really what enables them to assert their agency and their rights and really push for the dignity and move out of this invisible space in which they're caught doing care work, labor work, all of that. So I think things like when we look at SSGs, of course, the economic component of that is important to ensure, but also the agency and the empowerment component is just as important. And this is not, the work of women alone or women's groups alone. I think all of us who work in bastis, who have presence in urban poor communities, have to really look at supporting women and young people, because also this is going to be an economic crisis going ahead. Women and young people, young women, to really come together as collectives, which will really enable them to move their own economic and social indicators, but also assert and demand whatever entitlements they are entitled to from the state in a in a short way. But I also think, going back to the earlier question, when we look at municipalization, how do we really look at local government strengthening a key role for women in that as well? That is also very important, I think, if we really want to ask these very, very critical and long standing questions that you raised, Professor.
Yes, thanks, Roshni, for that. And I think that's really is more women leadership, and the more I think women out over there. You said about the local self-government, but I say is, the able women leaders like yours at in the civil society in all walks of life, and we see that I think one way to address this. Okay, thank you so much. I think it's my moment to thanks everybody. First of all, I think the participants who have been there all around, very patiently listening, and more importantly, for all the good work they have been doing on the front line of this COVID war. My opportunity to thank all the panelists, Mr. Arvind Uni, Mr. Avinash Singh, Kaira, Lisa, Roshni, all of you, and my thanks to my colleagues Navila for coordinating it, and I'm handing it back to her for final summary as well as any logistics announcement she would have to take. Over to you, Navila.
Yeah, thank you, Vikrant, for sharing this. I just want to make a last bit of announcement. Let me just share my screen. So, to thank you everyone. Thank you all the participants for being here in the session. To receive your certificate of participation, you can visit the link which is www.spearindiacovid19academy.org after 24 hours, and you will get your certificate of participation. Also, tomorrow we have two very important session. First, we have life-saving initiative during COVID-19. It is Rajasthan state officials will share the details of Mission Lisa with the participants. It is 11 a.m. to 12:30 p.m. And another session in the evening, we have a panel discussion again, which is the gendered impact during COVID-19. It's 4 p.m. to 5:30 p.m. So I look forward to the participation. The registration link will be mailed to everyone. And in case you can also visit our website and register through the website for the upcoming sessions. For any queries, any questions, any doubt, you can write to us at covid19academy@spearindia.org.in, and we will respond to your queries. With this, I would like to thank all the panelists for this very, very enriching and very, very important session. Thank you, Vikrant, for moderating the session. Thank you, everyone, for attending it. Have a great evening. Bye-bye, everyone.